So what's the difference between private cataract surgery and cataract surgery on the NHS? Well, really, there are three different kinds of surgery that I think we should be comparing. There's NHS cataract surgery, which is really about volume. It's about trying to help as many people as possible. And as with any volume business, it's about trying to keep things as simple as possible. And in fact, with a lot of providers, I've even heard the term using equipment and materials that are just clinically acceptable, the minimum that's clinically acceptable. Not the best possible, but just the minimum that is regarded as safe and effective for patients. And then we've got standard private cataract surgery. So with the conventional model of private cataract surgery, you may have individual surgeons in a large private hospital that's providing orthopedic surgery and plastic surgery and general surgery, and then they'll be doing some ophthalmology as well. And you may have an ophthalmologist undertaking their own scans and using the equipment and the lenses which that private hospital as a group have decided are going to be acceptable for private patients. And then we have a level of private cataract surgery that we've put together here at Custom Vision Clinic. And really the idea behind it was, let's imagine we're doing your mum's cataract surgery. It isn't just one component. We've looked at every single part of the process. So we've looked at the individual assessment, we've looked at the measurement of the eyes. So we take extra measurements to ensure that we have a complete understanding of the health and of the dimensions of that eye. We've invested in the latest formulae to calculate the correct powers of lenses. So these formulae aren't available, they're certainly not used on the NHS, and they're used in hardly any of the major private hospitals. But we've invested in these latest formulae, and this has resulted in a huge increase in the accuracy of our treatments. We use additional equipment in the theatre itself. And this may sound silly, but not all knives are the same, and this makes a difference to the safety of the procedure. If I'm using the best possible Rini blades and every time I touch the eye it's a perfect response, that is safer than occasionally having a blade handed to me that's blunt and results in force or trauma having to be used on the eye. So improved safety and improved comfort for our patients. And then the lens selection and lens tailoring. It is all based on what we think is going to be the best for those individual patients, not what we've negotiated a cheap bulk contract for. And then we give extra eye drops so that we're looking after every single part of the process right through to the end to make everything as good as it possibly can be and to customise everything for each individual patient. So do please give us a call on the number on the website or email us to ask for a call back, and one of my team will be delighted to call you. And we can then walk you through the next steps, and if possible we'd love to put you in for a free consultation at Custom Vision Clinic so that we can assess your lifestyle and visual needs and show you how we can help.